Senator Murkowski.
Thank you, Mr. Chairman. And gentlemen, thank you for not only your testimony today, but all that you have been doing. I think I've had conversations with each one of you about the Alaska-specific issues, most notably with regards to our seafood processing. This is the time of year where we typically welcome 1 million plus tourists, as well as many thousands that come up from the lower 48 and other places to help with our seafood processing. And it has been a very anxious time, I think, for all of us in Alaska as we see outsiders coming in. We have seen obviously elevated cases of confirmed COVID. Our numbers, I think, are enviable when other states look at us to know that we're working about 500 active cases right now, about double that in terms of what we have seen throughout this whole pandemic. But again, we know, and you have stated, that we don't have resources that we can look to neighboring states. We're kind of on our own island there in terms of resourcing. So what you have done to help facilitate, whether it's the plans with the seafood processors, the guidance, the ability to come in on an as-needed if the situation so demands. We appreciate that. We have seen the benefit of how these very rigorous plans have worked. An individual who comes up to work in a seafood processing facility is tested before they come to the state. They're tested when they get to the state. They're put in a 14-day quarantine. We have seen positive cases once people have arrived, but we've been able to do what the plan calls for, which is that contact tracing and then isolation and keeping things to a minimum. So I think it does demonstrate that these tough plans really can work. They are expensive, though. If you are bringing in several hundred or perhaps 1,000 workers and you have to put them up in a hotel for 14 days with pay, when you have to provide for the health protocols, this is costly. I would ask for your input, and probably a question for the record, just in terms of which agencies can best help facilitate these seafood processors with not only implementation of the specific guidance, but how we can be dealing with the costs. We do receive some benefit from the discretionary funds provided to the states, but I think we would all recognize, like the meat packing facilities, our seafood processors are an important and a critical industry, not only to Alaska, but to the country. So we want to work to address that. I do want to speak very quickly, though, to the public health infrastructure. I'm told that in Alaska, as we are doing our contact tracing, it is still a paper copy, Excel spreadsheet, faxed to the epidemiology labs. This is how we're doing our tracing. I thought, well, maybe that's just Alaska, and I'm told by Dr. Zink, who you have all had conversations with, that, well, this is actually going on in California as well. That, to me, is not a contact tracing system that works and is sufficient. So I want to ask about not only your view of the sufficiency of contact tracing, and this is probably to you, Dr. Redfield, but then, Dr. Fauci, I want to ask you about the concern that we have with certain parts of the country where you have public mistrust of vaccines in general. My fear is that we may get to the place where, we will get to that place where we have that successful vaccine, but we still have the concern from many and a mistrust, and whether it's vaccine hesitation or vaccine confidence, I don't know what the buzzword is, but I'm worried that we don't have a plan for how to deal with that. So first contact tracing and then the vaccine.
Thank you very much, Senator. I think it's really important just to highlight what you said about the current state of data systems for public health in the United States, that they really are in need of aggressive modernization. And again, thank Congress for the funding there, but it is a substantial investment that needs to take place. There are a number of counties that are still doing this pen and pencil, as you commented, and we need to have a comprehensive, integrated public health data system that's not only able to do something that's in real time, but actually can be predictive. And it would be one of the great, I think, investments of our time to make that happen once and for all. And that's really fundamental to be able to operationalize contact tracing, et cetera. And contact tracing in this case, and I'll be very quick, really doesn't have any value unless you can do it in real time. It doesn't help like I just did with the airlines where we had people that were flying infected from Afghanistan and we didn't get the information until day 14, day 15, day 16. It's irrelevant. So again, we love the partnership to get an integrated public health data system, not just for CDC, but for all of our jurisdictions across the nation into one timely integrated system.
Okay. Senator, thank you for the question about
If you could be succinct, we're well over time.
We'll be quick. We have a community engagement program that is embedded within the sites where the vaccine trials will be done because we're thoroughly aware of what you're concerned about, and it is a reality, a lack of trust of authority, a lack of trust in government, and a concern about vaccines in general. We need to engage the community by boots on the ground and getting community, particularly those populations that have not always been treated fairly by the government, minority populations, African Americans, Latinx, and Native Americans. And we have a program that's already operable right now to do that. Thank you.
Thank you.
Thank you, Senator Murkowski.